So yesterday we have seen that how to locate the code, what is placeholder, how we will like after locating the term in the alphabetic index, how we will search the tabular list. Like after searching in the subterm, we will go to the tabular list, right? And how we will check the characteristics in the tabular list. So we have seen all these things, right? When locating and assigning a code. So the alphabetic index does not always provide the full code. We will have the first three characters, and then the selection of full code will be having the laterality and any applicable seventh character. We have discussed all this yesterday, right? Any dash at the end of the alphabetic index entry, that means it is requiring additional characters which are required for the completion of the code, right? So even if dash is not included, it is still necessary to refer if there is any seventh character based upon the encounter like ADS, right? Yesterday we have discussed all these things. So let me show you the flow chart, okay? How to locate a code. So you will find the main term in the alphabetic index, and then if there is any subterm, if yes, then this is the process. Review the default code next to the intended term in the tabular list. Okay, then you will check the characteristics nodes, any additional code you need to give, or only any C, not elsewhere classified, or not otherwise specified NOAs, or like includes, excludes. You will see all that nodes and conventions, right? So you will see all the nodes and conventions in the tabular, also like you will see in the index also, right? So after checking that, you will go through the verification of characters required in the you will get in the tabular list, and you will complete the code through this. So send the complete code. If yes, you are getting subterm, then you will go through this chart. If you are having only single diagnosis and it is not having any subterm, so it is finalizing the condition to diagnose, then it is like review the default code for the main term in the tabular index, then view all the nodes and conventions, verify and complete the code. That is simple as that. So this is how you navigate, and I also showed you how you will navigate it in the real book. Okay, I have shared that link also yesterday, how you will check it. Okay, so coming to the level of detail in the code, this one also we have discussed. I think diagnosis codes are to be used and reported at their highest number of characters available. So if they are giving, for example, if they are giving in the tabular list, okay, 3, for example, let's say J18.9, okay, pneumonia code. Let's say what is the highest number of characters here? 9, right? So if anything is associated with pneumonia, and if anything like 91, 92, 93, so what is the highest number that is defined in the question? So what exactly they are asking, what is the highest number of characters that is available here for this? So here you will see in front of the code, you will see fourth character or fifth character or sixth character. So you will understand how you will decide in the characters. Okay, so based on that, this is the fourth character, right? If here he is mentioning, for example, I will show you again. So for example, J18.9, okay, he is mentioning, and here in front you are seeing fifth character, but here how many letters you have? 1, 2, 3, 4 only, right? After the point there is fourth character, but in front of the code here he is showing fifth character, which means that fifth character is required here. So we will check under this. There is 1, 2, 3, 4 lines, and he is saying 18.91, 18.92. So this, what is this considering here? What is it defining here? What is it denoting here? So the note mentioned about the 1 is to be like fifth. What is the fifth character? Yesterday we studied about the format and structure of the code, right? So the format and structure, what does it say? Fourth, fifth, sixth characters, they mention laterality or severity, acute or chronic. So based on that, your condition will be mentioned, right? It is classified there. So what he is saying, diagnosis codes, the level of detail in coding should be like this. Okay, so the diagnosis codes are to be used and reported at the highest number of characters available, and they must be reported at the highest level of specificity. So the specificity documented in the medical record, you should understand the level of specificity, the highest level of accuracy. So this will affect directly the accuracy. Why accuracy? Because it will impact the payment, reimbursement payment, right? So you should not take it as a textbook thing, guys. You should understand, relate always the subject with the real time scenarios, right? So if I am not giving the highest level of specificity, I am not giving the accuracy properly. Accuracy of code will disturb the people in the system. They don't know what it is exactly, and if you are giving incorrect codes, incorrect thing, so they might think, okay, this is less complicated, we will pay them less. So this is how it is going to affect in a large scale scenarios. So always go to the index first, then always go to the index first, and then you need to go to the index first, then subterms, then tabular, then highest number of characters, what it is, fourth, yeah, fifth or sixth or seventh. Accordingly, you will give the correct code. Okay. So this is how you will learn. So next, what it is there? So yeah, this is the thing we learned yesterday completely. Composed of codes with 3, 4, 5, 6, 7 characters and are included in the category of characters. So it is included in the heading of the category of codes. So maybe further subdivided 4th, 5th, 6th and 7th, which is in a greater detail. So the three character code is used to, it is to be used only if it is not further subdivided. So only three character code will be there sometimes. So that is to be used only when there is no further characters are there. Example, only three character code. Give me any example if you know. 0, 5. Only three characters. For what? This is code for cuff, right? So like this there will be some codes, direct codes. But this doesn't, it's like it's the main character code, and you may have cuff with sputum, okay, blood in the cuff or something like this, okay. I'm just giving randomly the example. So like this you will get an RO5, R05.1, 113, so 131. So like this it will be subdivided. Generally I'm telling you, so you don't need to remember all these things. You just remember that. So always a three character code is used to only, it can be used and it is not divided again. But if a code is not completely, if it is saying it has, a code is invalid if it is not being coded to the full number of characters required for that code. Which means if any code, if he is saying fifth character, okay, so this is fever code, okay, so he is saying like this, it is mentioning like this, fifth character, but here four characters are there and you are giving only like this in the exam, okay. So when he is saying fifth character, that there is something that is happening, okay, there is something associated with this fever, so that qualifies fifth character. So you, then if you are not giving that, then it will be invalid. So this code now it is invalid. Why? Because there is no fifth character here. So this is how you will understand the level of detail in the coding. Okay. So including the seventh character if applicable. So you need to include the seventh character. Yesterday we have discussed this. If applicable, you need to add the seventh character within all the codes, right? So coming to the next thing, this is just for the knowledge purpose, no need to remember anything, but just understand. So code or codes from A00 through T88.9 and E00 to Z99.8 and U00 to U85. So the appropriate code or codes from all these things may be used to identify. So altogether, all the codes from A to Z, they are used for what? Diagnosis, what is the problem, symptoms, after you get problem, what kind of symptoms they are getting. So definitive condition, so after problem explained and symptoms explained, so there is a definitive condition, definitive diagnosis, that is named as a condition. So what are the problems associated with it, what are the complaints, what are the other reasons for the visit, okay, this is very important to understand. Okay, we will discuss that later. This is the key word for, this is the key word to remember in any ICD, okay. So especially in ICD-10 CM guidelines, general guidelines or guidelines, the primary diagnosis always refers to the reason of the visit encounter. Okay, so this we will discuss further. So next we are seeing signs and symptoms. Code that describes symptoms and symptoms are acceptable for reporting purposes when a related definitive diagnosis has not been established. Okay, I will explain you. Don't get confused. Don't need, no need to panic here. I will show you what it is. Okay, code that describes signs and symptoms we are learning. What are the general official guidelines for the signs and symptoms? So, guys, this is general official guidelines which will be applicable in every chapter wherever is required. Okay, so this will be repeated even in the chapters. So, this is generally you are learning here. Okay, so you don't have to worry about it. Then let's go to the definition. Here it is saying codes that describe signs and symptoms. Okay, so these are applicable for reporting purposes when a definitive diagnosis has not been established, and then matlab means when the definitive diagnosis is not confirmed. Okay, at that time you can code the code of signs and symptoms. For example, scenario 1, no confirmed diagnosis. Okay, no confirmed diagnosis, which means there is no confirmed diagnosis. Patient is admitted with fever and cough. Patient is admitted with fever and cough. So there is no definite diagnosis here for which reason fever and cough is been there. Okay, so then you will code, what you will code, guess, any guesses? Fever code, also cough code. Okay, this is the first scenario where there is no confirmed diagnosis. So fever and cough is not taking anywhere, it is giving us question mark. So at that point of time we will give this two codes for the signs and symptoms which is affecting him very badly. Okay, him or her. So next, so that is first scenario, you can remember, and also contains many but not all codes for symptoms. So we don't have, like, all symptoms are not considered, only some symptoms like fever, like too much interrelated with the major conditions, those kind of symptoms only will take. Okay, so next point, signs and symptoms that are routinely associated with a disease process. One second, guys. Okay, so signs and symptoms that are routinely associated with a disease process should not be assigned as additional codes unless otherwise instructed by the classification. Okay, additional signs and symptoms that may not be associated routinely with the disease process should be coded when present. This we already explained just now. Okay, so first scenario, what we have, no confirmed diagnosis, but if there is any confirmed diagnosis is there, for example, patient is admitted with pneumonia plus fever plus cough. At that time you don't have to mention these signs and symptoms, but you can mention the definitive diagnosis. Okay, so this is another scenario. Okay, so here you are saying when associated with a definitive process, disease process, it should not be assigned as a additional codes, but if it is mentioned in the classification that you should mention the fever and cough also when important, then you can mention. Okay, otherwise no need. That is the second scenario. Third scenario, okay, I hope you understood scenario 2. Okay, this one. So third scenario is this one. For example, extra symptom, okay, pneumonia plus hemoptysis. Okay, pneumonia and hemoptysis, they are together. Okay, and when it is present and they are not interrelated. Okay, it is not associated with it, but the signs and symptoms are majorly affecting the patient. Okay, and it is giving the additional signs and symptoms along with the pneumonia symptoms, so then you can code this one. So that may not be present associated with the disease process should be coded when present. Okay, so these are the 1, 2, 3 scenarios. What is the first scenario, guys? What is the first scenario? Sorry. Okay, so first scenario, patient is coming with fever and only cough, no diagnosis. Okay, you can make a table in your notes also. If you can remember, if you make a table, right, then you will understand. Okay, let me make a table for you. Table, okay, for signs and symptoms. There are 3 scenarios. Scene 1, scene 2, scene 3. Just imagine a patient is coming. Okay, there is a patient, he is coming with fever and cough. What you will code? There is no diagnosis, definitive diagnosis. So what you will do? Only you will code only fever and cough code. Okay, scenario 2. Patient is coming with fever, cough and definitive diagnosis. What you will do? You will not give fever and cough, you will give only definitive diagnosis. Okay, scenario 3. Definitive diagnosis is there, but there is another additional symptom which is not related, but it is still there. It is not related to pneumonia or definitive diagnosis, but it is still there. So you will give both, okay, definitive diagnosis plus additional symptom when present. You should give both. So you understood, right? Three scenarios. Okay, this is how it goes. Next, conditions that are integral part of a disease process. Okay, signs and symptoms that are associated routinely with the disease process should not be assigned as a additional codes unless otherwise instructed by the classification. So for example, patient is coming with a diabetes, okay, with polyuria is a routine, like it is a routine additional, like routine routine thing which is happening along with the diabetes, okay. So then you will not code the polyuria separately, okay. So it's very simple to understand. So here we explain na scene to the same thing here also, okay. So when a patient is coming, for example, let me take high blood pressure, hypertension is there along with stroke. So is it included or not? So both are interrelated, right? Then you don't have to code IBP, okay? So that is the same thing. Again, you are learning integral part of a disease. So when it is integral part of a disease, you will not code the signs and symptom. You will code only the definitive diagnosis, which already we discussed. Next, conditions that are not integral part of a disease. So diabetes plus chest pain, if you see, okay, diabetes plus chest pain, if you see, chest pain is not a routine, right? So those are not interrelated. So what you will do? You will code both, right? Diabetes plus chest pain. Patient is admitted with both. Okay. So then you will code 11.9 and R07.9. Okay. So this is how we will code both because they are not interrelated. Conditions that are not an integral part of a disease process, additional signs and symptoms that may not be associated with the disease process should be coded when present. Okay. If it is present associated with the major condition, you should mention it, as simple as that. So next, multiple coding for a single condition. In addition to etiology or manifestation, guys, if you are a medical student, you will understand what is a clinical feature is nothing but signs and symptoms, both, okay. Like redness, if anybody is having infection, they have redness, warmth, and pus formation, okay. If it is an open wound, there is a pus form. These are all clinical feature, like manifestation coming from the main condition, okay. So certain conditions require more than one code to fully describe a single condition that affects multiple body systems, right? So then you have to use additional code, okay, that are found in the tabular list, indicate the secondary code should be added. For example, there is a urinary tract infection, UTI, okay, urinary tract infection. It is happening due to E. coli, okay. So E. coli is a bacteria, right? So then you will code the both to fully describe, okay, because UTI can be happening with many bacteria. There are possibilities, right? So for a single condition, in order to give accurate code, if there is a bacteria present and after study you are getting the information that this bacteria is causing, lab test we will do, right? So this organism is causing the UTI, then you should code that particular organism. So along with the definitive diagnosis, this you should remember this thing, okay. Then next, what we will see here, use additional code for that, and then these additional code are not part of the etiology pair. The sequence rule for etiology remains the same. So meanwhile we are learning sequence rule also here. Multiple coding for a single condition. Okay, UTI is the single condition. We got it. And after study we are code UTI plus E. coli. It is causing the UTI. It is a secondary code that should be added. So what is the sequence here? The main cause or the definitive diagnosis? Obviously the definitive diagnosis. So it remains the same, okay. Example, Okay, we have example here only. Example from the guidelines. For bacterial infections that are not included in the chapter 1. For example, infectious diseases is the chapter 1, right? So, which are not related to that chapter, additional code may be used because organs are mentioned in the B series, guys, B95 to B99. To identify the bacterial organism, use additional code like B series you should mention. Okay, got it? So, now we have discussed this much. So next, I think we can complete this today, guys. Okay, we can complete this and wrap up today. Okay, so what is code first notes? Conventions, guys. You are seeing conventions also in the middle here. What is code first notes? These are also found under certain codes. Okay, these are also found under certain codes that are not specifically manifestation codes but may be due to an underlying cause. When a code first note, okay, is present and an underlying condition exists, the underlying condition must be sequenced first. Okay, so here manifestation codes are not specified, but there is an underlying code cause. So when you see code first note, okay, you will actually see the underlying condition that is first, and then that should be sequenced first. Example, there is diabetic nephropathy. Okay, so what we will do here, he didn't mention type 1 or type 2, so we will take it by default type 2, diabetic mellitus plus nephropathy, right? So this is actually a combination code, so there is no separate code first here. Okay, so this is a combination code because both are interrelated, so there is no code first here. But what if there is a code first? So what is the condition? CKD, chronic kidney disease. CKD, chronic kidney disease due to diabetes. Okay, first we got diabetes, then you got because of that CKD. So what is code first? So when you go to CKD stage 3, you might see something like this code first, and diabetes code you will see like 11. So when you see in the tabular, okay, N18.3 under CKD stage 3, 18.3 means stage 3, okay, N18 is the chronic kidney disease main character code. Okay, let me write it properly for you. Okay, this is very important. So first you are seeing CKD with diabetes. This is with symbol, guys, medically. Okay, with diabetes. So underlying cause, what is underlying cause? First he got diabetes. Through diabetes, it has increased progressively to CKD. What is the stage? Third stage, right? So first we will check the for which condition he got admitted due to chronic kidney disease, right? So when we go and search N18.3, we can see there. And when we see N18.3 in chronic kidney disease, you can see in the notes key like code first 11, like this you will see. So then we need to understand there is a sequence step here. First should be underlying cause. Then like you will find out even in the question like this, patient is admitted with CKD with the history of diabetes. So because of diabetes he got the CKD and it is in the stage 3 now. So all the tests are happening. So so like this you will get a question, and underlying cause you need to code first. Then what is the code sequence here? And then you will code N18 point. Okay, this is how the code was note we should be using in the tabular column. Okay, tabular or alphabetic index. Okay, next, code if applicable any casual condition first. This indicates the code may be assigned as a principal diagnosis when the casual condition is unknown or not applicable. If the casual condition is known, it must be sequenced as the principal or first listed diagnosis. Okay, the code may be assigned as a principal diagnosis. Okay, when the casual condition is unknown or not applicable. So, for example, a patient is coming. Okay, so let us see an example here. Code, if applicable, any casual condition first. So, forget about the paragraphs. Okay, first understand the example. Code, if applicable, any casual condition first. Okay, so for example, there is a anemia. Patient is admitted with anemia and due to chronic kidney disease. Okay, why kidney disease will lead to anemia? Because all the blood formation, blood cells formation, everything will happen in the kidneys only, right? You know that. So if kidney is not working properly, there is no production of red blood cells, right? So that will indirectly lead to anemia. Okay, so anemia plus CKD it is there. So what is the cause here first? Kidney disease, which is obvious, right? In 18.9, and then we will go to anemia also, anemia and CKD, because cause is known now. Okay, cause is known. Okay, so casual condition we need to code first if applicable. But sometimes there is a casual condition like anemia, and the patient is admitted only with anemia, cause is not documented. Then what you will do? You will code only anemia, D64.9, anemia unspecified. Okay, that's the meaning of this. The code may be assigned as a principal diagnosis when casual condition is not known. Okay, when anemia is not associated with any other condition, you can take it as a casual condition, like every time we see, and it is unspecified why it has happened, and then you code the main character of that. Okay, you understood, right? Then multiple codes may be needed for sequela. What is sequela? Coming after years. The same problem. First it came, he got treated, he is coming again and again for that. So that is sequela. Complication codes. He came after 5 days because of the surgery or post surgery. He got some complications. That is it. So obstetric codes. There are multiple codes for obstetric codes also. Like main condition will be there. And then additional to that, there are additional codes also. So multiple codes will be there for, may be needed for sequela. Generally they are saying complications, obstetric codes, or to fully describe the condition. Okay, next, acute and chronic condition. This is very important. Okay, acute and chronic condition. If the same condition is described as acute and chronic, okay, acute or subacute and chronic, and separate subentries exist in the alphabetic index at the same in level, code both. Sequence the acute code first. Okay, so they are mentioning two rules here. First rule, code both. Second rule, sequence. Which one will come first? Acute or subacute, which they are suffering right now. So the patient is admitted always with the acute only. It's not about like after so many years he is complaining about that problem. No. Patient always admit with the acute with the chronic condition. For example, for this I am giving example. Okay. If the same condition is described as both. Okay. Example, acute on asthma. Acute on chronic asthma. What we will do? We will code acute first and then we will code the chronic also within the same sixth character. So it lies in the same sixth character in the tabular column. So what is the common code here for asthma? You can remember as J45 is the asthma code. In that acute code is 1, chronic code is 9. As simple as that. Okay. So you will code both. When he is saying patient is admitted with acute on chronic asthma, he is saying acute on chronic hypertension, acute on kidney disease, chronic kidney disease. So you will mention always both, but you will code first the acute first and then chronic. So that's the sequence. Okay, I hope you understood this. So next, combination code. A combination code is a single code used to classify two diagnoses or a diagnosis with associated secondary process manifestation or a diagnosis with an associated complication. Okay, combination code is a single code used to classify two diagnoses, a diagnosis with associated secondary process or clinical feature manifestation, a diagnosis with an associated complication. So we have three things here. What is first one? I think let's use red only, right? You can see I think properly with the red. So first you have two conditions, two codes, one code. This is the combination code, guys. Combination means for multiple codes you have only one code already settled there. Then two condition, one condition plus one manifestation, symptom, signs and symptoms. Okay, then also combination code CC you can say. Third one diagnosis, one condition or one diagnosis plus there is a complication. So for that also you have one code, which means these are interrelated. Okay, this we all already know, complication associated with the same. We have a combination code. Okay, so they are not separately used, they will be used in the combination code. Okay, combination codes are identified by referring to subterm entries, reading the inclusion excluded exclusion notes in the tabular list. Okay, so example, let us see. First example, two diagnoses, right? First example, type 2 diabetes mellitus with neuropathy. What you will do? You will not code neuropathy, diabetes mellitus separately. You will code single code 11.40. Then manifestation and diagnosis, scar due to burn. Patient is coming with scar due to burns. So what is he admitted for? Because of scar he admitted. So first we will write this, then we will also, okay, so like this you have example with two diagnoses. Already we have mentioned the secondary process associated complication example before. So this is the combination code. So where you will get combination codes, where you can identify, you don't have to memorize everything. You have to just refer the alphabetic index and then just see the inclusion exclusion notes. For example, if you have J, okay, sixth character, example I'm saying guys, asthma codes, okay. Here you can see in the sub entry, you can see excludes this. So it is not the part of asthma, then he will mention like this notes, and includes he will write 902, 903, 904. Okay, so many other classification of that asthma it will be included. So that is given in the include notes. So exclude notes also is there. So these determine your combination codes. If needed you can do, otherwise no need. Okay, so next, assign only the combination code when the code fully identifies the diagnostic conditions involved, or when the alphabetic index so directs. So alphabetic index will tell you include, then you have to include, otherwise you have a combination code. So assign only the combination code when that code fully identifies the diagnostic conditions involved. Okay, otherwise alphabetic index also directs. So multiple coding should not be used when the classification provides a combination code that clearly identifies all the elements documented in the diagnosis. So there is a combination code that is explaining both, right? Type 2, like type 2 diabetes mellitus plus neuropathy, it is mentioning already that code E11 point. So it is mentioning diabetes mellitus with neuropathy, you have that proper code. So why you need to separate that? So no need multiple codes, right? So that's the thing what you say. So when the combination code lacks the necessary specificity in describing the clinical features, manifestation or anything, then additional code should be used as a secondary diagnosis code. Okay, secondary code. So then you will get two codes. Okay, if there is no relation between them or any required classification is not there, then you will mention this. Okay, so next, sequela, late effects. Okay, let's say somebody is burnt, having burns in hand, and that got scar, and that scar is itching, and it is having it is showing the scales, removal of scales over the scar, and it is continuously creating problem. It is going like open wound and it is going into pus. So these are late effects of the main underlying cause, which is burns. So a sequel is the residual effect condition produced after the acute phase of illness. Acute means within 6 months, okay, within 6 to 1 year, between, anywhere between acute phase of illness, if they are facing the other effect, residual effect, then that is has to be terminated. That is called sequela. There is no time limit for on when a sequela can be used. The residual may be apparent early. Okay, cerebral infection is the example. It may occur months or years later also. So examples given in the guideline are scar formation resulting from a burn, you know, right? Deviated nasal septum due to nasal fracture. Okay, so we will see. I'm not good at diagrams, but I will try. Okay, so this is normal nose. Okay, but for some people it will be like this nose deviated because there is a fracture here in the nose. Okay, so infertility due to tubal occlusion from the tuberculosis. So first tuberculosis they got TB, because of TB they got tubal occlusion, then they got infertility. So that's how your sequela affects, guys. Okay, next. Coding of Sequela generally requires two codes. Okay, the two codes sequenced as follows. The condition or nature of the sequela is sequenced first, and then sequela code is sequenced second. For example, scar due to burn, right? scar due to burn. So you will code scar first and burn second. T20.320.30xs. So always residual code first and then main code second. Okay, mostly we'll see example like scars and burns only. Next, impending or threatened condition. Code any condition described at the time of discharge, remember. Threatened condition or impending condition. Okay, so if the condition did occur during the encounter, it must be coded as a confirmed diagnosis. We know that. Visit, reason for visit, let's say RV. So, reason for visit is saying there is a definitive diagnosis, then confirmed diagnosis. If the condition did not occur first, okay, coder must refer alphabetic index to determine whether the condition in the subentry is mentioning about impending or threatened. If the subterms are listed, assign the code indicated for the impending or threatened condition. If the subterms are not listed, code the existing underlying conditions. Do not code the condition as a impending or threatened. Okay, so example, let me tell you. We have a threatened abortion code. So it did not occur before. Okay, so O, this is obstetric code O code. Okay, O0, O20.0 is the threatened abortion. So patient is admitted with threatened myocardial infarction. Then what you will do? MI happened already, right? So then you will code I. So which means it is about to happen. After the visit, it may happen. There is a threaten, like there is a threatening condition, like it may happen, it might occur, and it had happened at the time of like near to the discharge date. So if your alphabetic index is showing subterms, then you code the existing underlying condition first. Okay, do not code condition as a impending condition. So flowchart for impending and threatened. Provide documents impending threatened condition, he will say. Then did the condition occur during the visit? If yes, code the confirmed diagnosis. If no, at the time of visit there is no threatened condition like this. So we review, okay, and we look for the terms threatened, subterm or impending. If subterm is available, it is saying yes, given the assigned code. If no, then code the underlying condition. Okay. So basically what they are saying, na, you will see the document. In the document, doctor will write threatened condition. So what we will see, the reason of visit, is it there or not? So if it is there in the reason of visit, then yeah, we will write the name of that condition as it is in the from the question. If there is no definitive, we will go to the alphabetic index, all that always. And then if we see any threatened as a subterm like this subterm, then if in that subterm also if you are saying like subterm you are seeing, then assign that subterm code. If not, directly assign the code which is mentioned in the question. Okay, so these are the impending conditions.